Today, we're delving into a profession that often operates behind the scenes, but plays a pivotal role in patient care, the world of respiratory therapy. Our guest, Heather Whetsel, brings a wealth of experience and passion to the conversation as she walks us through the intricacies of her daily life as a respiratory therapist. This is Career Chats with Katie and Robin.
Welcome, Heather. We're so excited to have you on Career Chats today.
Thank you.
To begin, why don't you tell us what you do and what a typical day on the job looks like?
Okay, my name is Heather Whetsel. I'm a respiratory therapist. I'm a supervisor in my role. So my typical day is I go in early enough to meet with my night shifters and kind of touch base with them, help finish up their shift if I can give any helping hands, and then get the day shift off onto what their day is going to look like as far as their assignments. As respiratory therapists, we navigate through the whole hospital. So it's not just one unit. I don't typically have an assignment or a specific patient load I'm seeing, but my staff does. And then I just navigate and kind of pick up where they need the most help. That goes on throughout the day. We have patients that we see every 2 hours, every 4 hours. It just varies on depending on what kind of therapy we're giving. And meanwhile, I also work on just housekeeping items as far as being a supervisor with scheduling, time cards, and things like that.
Can you tell us a little bit about more maybe what your staff day looks like? What exactly does a respiratory therapist do with the patients?
One of the beauties of being a respiratory therapist is that you start your day, you're not assigned to a specific unit per se. Some hospitals might have what they call unit-based, meaning you could be in the ICU or you could be on just the medical surge floor. But our hospital, we vary. So we rotate. Everybody goes through the ICU. They might have a day where you're only in the ICU, or you might only be in the emergency room, or you might only be on the med-surg floors or the progressive care floors. If you're in the ICU per se, so you're going to look at your patient's information on their chart, check their orders, check all of their vitals, all of their assessments, their x-rays, their labs, kind of get an idea what your patient looks like on, the technical side. So when you go in, you can have a better view of like what kind of more to expect, how aggressive therapy you need to be. Do you need to spend more time with this patient versus they're on their way of weaning their way out of the ICU or out of the hospital. So we start with getting basic assessments off the computer, and then you start with your morning rounds. In the ICU, at our hospital, we do ventilator rounds every 2 hours. So we manage the ventilator. We have aerosol nebulizer treatments, volume expansion treatments. We do blood gases on patients. So we'll stick for arterial blood gases, and then we analyze those. And if those patients are on the ventilator, then we make proper adjustments on how to get those parameters in the correct range for that patient. We work very closely with rounding with our physicians, depending on when they're rounding in the ICU, checking on their ventilator patients, or even just their aerosol. During those first rounds, we take time for that assessment I spoke of earlier as far as on the computer, and then we make sure that our patients are getting the appropriate treatment. Maybe we need to add something. Maybe they need more of a medication that helps open up their lungs or helps secretions they have a pneumonia to help mobilize those secretions. So we can add different therapies and medications as far as our protocols. And so we have that autonomy with our patients and have a great rapport with our advanced providers to make those changes, under a set policy, of course. We're constantly looking at that our first round. Typical hospitals, the shifts go from 7 a to 7:30 p.m., usually 12-hour shifts these days. Some hospitals will do 8 hours, 10 hours, depending on where you're at. That's the majority of the hospitals, at least in this area.
Okay. Wow. That's a full day.
Yeah. Some days are obviously busier than others.
So how did you find yourself in this job? Was it something you had on the radar, like going through school, or did you happen upon it after the fact?
I'm a big advocate for respiratory therapy. I did not know about this profession until I was in college. I graduated college in 1995, so I've been doing it a long time. I started nursing because everybody wants, go into nursing, go into healthcare. And at the time, I was putting myself through college, and I'm like, is this what I want to do? And I took those basic classes, and then I went to a career fair and found respiratory, and I was like, oh, this is more of a specialty bedside care. We work very tightly with nursing, and we're at the bedside a lot, but we're not just with that one patient. And we specialize from pretty much the waist up, which was what I kind of was more, interested in. So I looked in more into it, and then I ended up shifting gears from nursing to respiratory after I found it. And then the rest is history. I've been doing it ever since.
It's awesome.
Can you tell us a little bit more about what the requirements are in terms of schooling or certifications or even clinical hours? What does that look like?
It's a state licensed, national credentialed profession. So you have to get an associate's or a bachelor's degree. You're going to have the same credentialing with both associates and a bachelor's. After you graduate, you take the credentialing degree. There's 2 levels. There's a CRT and a RRT, which is registered respiratory therapist, which ultimately is what every employer wants you to have. Those are pretty intense testing, but I feel like the schools do pretty good providing instruction to get through that. When you are in school, you do have clinicals. So, and every school works a little differently, but typically they put those students through those 12-hour clinical days, just like you would as you're working, so they can prepare themselves. You have to have so many clinical hours, and they're usually intermixed between, like, you'll have classroom work and then you'll have your clinical days 2 days a week.
So what's your favorite part of the job?
I love patient care. I mean, I taught for many years, but I always stayed bedside because I just enjoy my patients. I enjoy talking to them. I enjoy all aspects. I love ICU, but I also love just being able to go in and give a breathing treatment and, just see what their life is about and just hear their stories and things like that too. So there's so many different rewarding things to, you see these people improve. You see these people that you thought were honestly going to pass, and then all of a sudden they're waking up and they're, you just see that progression. You think, wow, we did this. We got this patient off the ventilator and they're strong and they're going to be discharged to, maybe if it's a rehab, but still they're getting out of here and can enjoy their families. And it's pretty rewarding.
That's amazing. So what would you say your least favorite part is?
Oh, well, those patients that aren't doing so great, we manage the mechanical ventilator. So that's basically the breathing machine. It's really difficult when you have those patients that you see their loved ones. You try to separate yourself as far as, okay, I'm at bedside, I see what's happening, but you really don't register exactly until you can equate it to, like, family members losing loved ones. And if you've ever been in any situation that's relatable, it makes it really hard. As a respiratory therapist, we pull that breathing tube out. We're the last ones to basically see in those eyes when when we pull the tube out and that their life is gone at that point. That's the hardest part for sure.
Wow.
As terrible as that piece is, sometimes that patient is better off. Sometimes it's okay that if it's their time to go and you're kind of relieving them from that pain too.
Yeah. What kind of personalities do you think would thrive in the day-to-day work environment that this offers?
I think that you have to be motivated. You have to be able to go with the flow a little bit. You can't, if your day's not going to look exactly like you think it's going to look. Oftentimes it is routine and you go and you do your typical therapy and nothing happens, or you're doing your therapy and you get called to a code blue. And so you immediately have to stop and go to help resuscitate the patient because respiratory is at the head of the bed. Sometimes we're putting that breathing tube down. We're doing compressions. We're breathing for the patient during those situations. So you have to be flexible. I mean, you have to be able to multitask and prioritize and make sure, like, okay, this is okay if I leave this patient because I have to go to this emergency. I think you also have to be caring, but also be able to have that protective shield. A sensitive person, maybe that takes on somebody else's problems or illness or sadness, it might be a little bit difficult if you have that personality, but I always strongly encourage people to shadow because I think it's a great way to see, like, and I used to be an instructor for the respiratory therapy school before things changed and visitors in the hospital. That was mandatory. Like, you had to go shadow an RT before you even applied to the program because that way you see what is actually, because it's hard to describe. It's really hard to describe.
Is there anything else you would tell someone who's thinking about entering the field?
Realizing that there are options. If you always wanted to work with pediatrics, you can do that. As far as, like, the specialties, you could work in home care who do, like, patients with CPAP. You could work in PFT, meaning pulmonary function testing. You could do pulmonary rehab. The gamut, you have a wide variety of options and flexibility as far as hours and things that makes it really great too.
Yeah. So do you think there's going to be more or less opportunities for people to do this work in the future?
More. We are in need now. Healthcare in general is short-staffed. You'll hear travel positions. So you have options. You can work at a hospital full-time. Some hospitals have part-time, so that would be maybe 12 hours a week. Other hospitals will have weekend only, where you only work the weekends. There's also PRN or as needed. So you could just work and have a commitment depending on your hospital. Say you want to work full time, then you have children and you're like, I can't work full time. I want to be able to have some flexibility. It's great for that option because you can pick and choose. You can do a PRN position. I did that for years. I did contract and PRN while my kiddos were little, and it just worked out for our schedule. So there is that flexibility there, which is nice.
So you've been doing this for a while. You're now a supervisor. Is this what you plan on doing till retirement, or do you have other thoughts and goals in mind?
I don't know if I'll be at bedside in the hospital until retirement, but I definitely will be doing something, I think, in respiratory. My husband works for an insurance company, and they have some respiratory therapists who work on this at home remotely and just doing like patient telehealth with them. So, do I transition to something like that? I might. I wouldn't mind doing pulmonary rehab. I mean, I'm not quite ready to give up my bedside. I don't want to give up that skill set. I still enjoy it. I'm an empty nester. My kiddos are, like one's almost graduating college, the other one's a sophomore. So once those financial demands are a little less, then maybe I'll, scoot into a part-time job. I don't know.
It seems like there's so many options and flexibility. I love it.
Yeah.
Is there anything at all you would like our listeners to know about becoming a respiratory therapist?
If you want to be bedside, if you want to do patient care, if nursing is not an option for you, respiratory is an amazing opportunity just to take a look at. I mean, it's not for the squeamish. You have secretions. Mm-hmm. It's funny. Nursing, we banter back and forth all the time. I'm like, I can't do the vomit and the stool. And they're like, I can't do the snot. So, it's like a win-win situation, teamwork. It's just a great way to be part of that patient experience, patient care, have great outcomes, work closely with the team group of with the physicians and the advanced providers, and that meaning like a nurse practitioners and things like that. And it has great flexibility and options. And if you have your bachelor's degree, that's one benefit from the associates to the bachelor's. You have opportunity to do things like maybe you want to teach respiratory, or now some are master's preferred programs, but some are not. So that's an option. You could do management, you could do, other careers, project management. My husband was a respiratory therapist and he's completely out of it, but he transitioned into more of a project management role for a lab. I would encourage you to get a bachelor's degree just because if you're not loving that bedside piece, you have options and you have that healthcare experience that'll help navigate you to something else.
Great advice.
Smart.
Heather, everything was so great. Thank you so much for being here today. We really, really appreciate it.
Yes, thank you.
Thrilled to be here to talk about it.
Career Chats is hosted by Katie Huddleston and Robin Coney. Show notes and guest info can be found on our website, careerchats.show. If you enjoyed this episode, we'd love you to subscribe and share this podcast with your friends. Until next time, stay curious.